Hey Beeves, this week we're talking about ex-gay therapy and ex-gays, and what we think about that, what our opinion is on that part of the community. And it's actually perfectly timed because earlier this month California passed a ban on ex-gay therapy, like conversion therapy, from mental health counselors. They're no longer allowed to practice that. So that was a huge deal, specifically because I used to work in mental health and have spent a lot of time in the hospitals, and we see a lot of teenagers who are struggling with a lot of different things, sexual orientation being one of them. So I personally think that it's a manipulative practice. I feel like it's hard enough to come of age and decide who you're going to be and how you're going to be that, and so to have these like mentors, if you want to say, to have these adults in the community, either be it religious adults or clinical professionals, try to convince someone that this particular part of their personality needs to be shunned, and is the reason for their sickness, I think it does a lot to a person internally. I don't think that we necessarily think about the shame attached to a person denying who they are. I think that people do it all the time for many different reasons. I think that we live in a society where some things still aren't okay. I feel like I've done this about 20 times because I hope that you hear the context in which I'm speaking. I wish that no one felt the need to hide themselves, but I do understand that it happens. It happens in religion, it happens in politics, it happens in the military, and even though laws are being passed to protect us from those, it's still going to be a long time coming until people don't feel the need to go there. On the flip side, people who do choose to become celibate or enter into a straight relationship to prove to themselves that they aren't this way, I actually do understand it. And the scary thing is, if you tell yourself something long enough, and if you're manipulated in a certain way, you can start to become someone else. And it comes at a really high cost. So I feel like those people have a lot of self-loathing and depression, and they are a great percentage of the suicide rate, and just a negative quality of life altogether. So, I don't suggest it. But I do understand that some people feel like they're in between a rock and a hard place. So, what are you going to do? That's what I have to say about that. So, I am about to head out. I'm sitting outside because it's really nice today. But I'm about to head out and have dinner with Lori and Michelle. Finally! I haven't seen Lori since I've been here, and I'm so excited to see her. And hopefully Michelle will post a video today as well. So look forward to that, and I'll catch you guys next week. Adios.